Staff in NHS, everyone is so supportive and they give like time for
Yeah.
adjustment, supernumerary, everything. Some people they have a pain and they are not getting the interview. It's hard to get interview.
Most of the trust will send the interview questions in advance.
That you work as a deputy manager, right? In your area. So then I was like, okay, this is a right person to approach because there are so many people nowadays, even they are not from the same field,
Hmm.
but they will advertise themselves as they will help
Okay.
you in preparation.
And this is a lifetime investment, isn't it? Because you're getting the job.
Yeah, that's true. That's true. It's nothing compared to what we get.
So it doesn't matter whether your opponents are working in NHS or not. It only matters how you perform in your interview. Mm.
Sometimes I think it's a all God who
Yeah.
showed me your profile and
No,
give that idea
it's
in
all
my
great.
mind to approach you.
Hi, Jagvir. How are you, by the way? Is everything okay?
Yeah, I'm doing good. Thank you. How are you?
I'm good as well. Yeah. So you have moved completely to Cambridge now, or
Yeah, I moved to Cambridge now.
anyway, congratulations for securing the Band 5 job. So
Thank you. Thank you so much.
that's also very important that you got the job in Cambridge University Hospital. Uh,
Yeah,
I know from the start itself you've been like trying to hard work to get the job and everything. So
yeah,
many congratulations. We are really happy that you got the job, you got the preparation and everything done. So like
yeah,
I still remember when we are going through the interview, you have struggled through the first questions.
yeah,
You said so so I have gone through everything, but I'm not sure how I'm going to answer. Uh,
yeah.
I
Answered. Yeah, this I told you. That's why.
yeah,
Yeah,
from the initial questions I've been giving you the feedback. Okay, Jagvir, just calm down. We need to go through this bit. We need to explain
yeah.
all these bits. So, how did the preparation help you? Like, have it made you a big impact in your preparation and everything? What do you say?
Yeah, I think in preparation wise, it was well, like in kind of building my confidence as well. Because sometime you know how to communicate, but you need validation from someone
Hmm,
who works in the same industry, isn't it?
exactly.
Before even coming to job, when I saw your profile, I
Yeah.
saw like you gave an interview preparation, and I was searching around at that time after getting that particular interview because I got literally first interview and I didn't want to miss it, right? Like wait for like some people do like, okay, I'm not gonna go to you in the first interview.
Yeah.
They will give their first interview, they will like try their luck, they will say, okay, if I didn't pass first or
I'll
second,
go for
I
it.
might do the third interview because they want to learn.
Yeah.
But I'm not that kind of person. I want to learn from
You
the
want to get
beginning.
that.
Even for first interview you want to prepare,
Yes,
know how it happened,
you got the chance, isn't it?
experience for giving a second interview.
Yeah.
Well, I will learn how the environment work
This
itself.
is what we
But
said, isn't it? This is what we said during the interview as well. Like after the mock session, I told you, like, Jagvir, just consider this as like either it is positive or negative. Just
yeah,
consider it as an experience, isn't it?
yeah.
So we don't know if anything can go
Yeah,
wrong.
you were telling me the same. But yeah, then I thought sometime the interview preparation itself, it helps because
Yeah,
before approaching you, I was really nervous what I'm gonna say.
yeah,
Like sometime, you know what, you know little bit how to talk. I think communication really matters. It's not
exactly.
only about the what words we say. We need to communicate,
Hmm.
one to one with them. They should feel like you can communicate well here. It's not
That's
like we are giving interview in
important.
our country, in our language. You should feel comfortable when you
Exactly,
being
because you're dealing with
interviewed.
the patients, you're going to
Yeah,
speak to the team, you need to work within the team as well. So
yeah,
that's really important because yesterday also I had a candidate who worked back in Punjab before. So she's currently here in the UK for like nearly 3 years.
yeah.
Like I think Harjinder Kaur. So I just
Okay.
saw like we have recently had an interview successful candidate. Her name is Jagvir Kaur. So
Yeah,
I just explained like because how did you prepare and everything, how we explained all the bits. But when we've been talking together, she said like, "Sir, थोड़ा सा आप हिंदी में बात कर सकते हैं, sir, in between."
yeah,
She
yeah,
wasn't comfortable like completely. She wasn't able to understand a lots of things. So I
yeah.
need to like give her explanations in Hindi as well in between.
Yeah,
So
that's true. That's what I think. Like a lot of people think that, okay, they can't blame you if someone is coming to you and they are asking literally those kind of questions. Like I know a lot of people, they would ask like they would blame someone. Okay, I went for interview preparation and I didn't pass. Actually, you can only tell, right, how to prepare for interview, what kind of questions there would be, right, how you can answer them. You can give the reference literally, but
You need to do the hard work.
what I feel like when you go in the actual interview, they can take reference from those points, but they have to give example when they ask like, okay, how would you handle the situation?
Yeah,
And how did, like, they ask literally,
yeah,
how did you handle the situation in the past? You have to, even if you don't have experience, you can give like reference.
yeah,
Okay, if it comes, I would handle like this. Like, I don't have experience. You can be honest. But you can't tell them, okay, you can say this literally, isn't it? Like
yeah,
they have to tell what they mention in their application according to their experience. Like,
exactly.
let's say I didn't had any experience in my, like, later to my particular role,
Yeah.
but only experience I had in my education level, right? When I was
Mm.
studying, right? I told them it was like literally a little bit of experience what I have. I don't know that much, but I am willing to learn.
Yeah. So that's why
Yeah,
you
you have to
being
prove yourself, isn't
open
it?
and honest, isn't it? So you're being open and honest. You're not telling them any lie, but you're still explaining them, and you're always open to get any kind of training as well. That you got a
Yeah.
chance, and who knows that you will get another chance later, isn't it?
Yeah, that's what.
Like the first interview, you got the job, which is the best.
That's crazy when I think about it, because I know the people around me who
Mm.
have, like, literally more experience than me.
Yeah.
And like,
That's why when we
wise, they might have a master's and something, but I don't understand. Like, still, I sometimes I think like, oh,
that kind of dream thing, isn't it? Like they called you and said that you got the job and everything. So that this is
yeah.
why, like I always,
Like, when I called you, like after my interview, I told you, right? Like, I thought that I'm gonna pass because they asked me when I finished the interview, they asked me, okay, what are you doing after interview, right? They told me particularly that they will call me either on the weekend,
yeah.
or if they don't call me on weekend, they will let me know on Monday.
Okay.
Because if they are telling you particularly that, I thought like personally, like if they are telling me if I had a
Might have-
plans, or they will let me know till Monday or
Hmm.
something, right? So I thought, oh, there is a chance maybe, like,
The
I
job.
would pass.
Okay.
So because of that, I didn't have to go for another interview, because I think another interview was far away as well.
Yeah.
So I was thinking like I might go for that. It might be like, because it was a first interview.
Yeah.
So I thought, okay, it's just a trial. In my mind, I was thinking like, even nowadays, there are some people, they have a pin and they are not getting the interview. Like, it's hard to get interview. And you
Exactly.
should really be like, you should really be grateful and go, like, go there
Prepare.
prepared, rather than like, waiting for the second chance and thinking, okay, I will approach you. Then I saw your profile. I was thinking, okay, should I approach or should I not? Like, you really think every time you go on social media, because there are so many people. Then I
Exactly.
was searching, like, what you do and all
Okay.
that. Then
Yeah.
you literally mentioned on your profile that, oh, you work as a deputy manager, right? In your area. So then I was like, okay, this is a right person to approach, because, like, there are so many people nowadays, even they are not from the same field,
Hmm.
but they will advertise themselves as they will help
Okay.
you in preparation.
All right.
But,
But they
but they had no experience in your field. You should, but I think, like, before even approaching anyone, people should research, like, okay,
exactly that you
actually,
are with the right
this
person.
person is working in the same field to
Yeah.
teach you.
Mm.
Like, if someone is not working, they can't tell you what they're going to ask.
No, they don't even know what exactly is happening in the hospital.
Yeah,
It's
yeah.
not simply teaching you. It's like sharing you the experience. Uh,
Experience.
so,
Yeah, thank you.
how's everything going on? How's the new job? Are you excited?
Yeah, new job is going well actually. I was like a bit nervous as, like, when I started, but I think everything went well because the staff in NHS, everyone is so supportive and they gave like time for
Yeah.
adjustment, supernumeracy, everything.
And it's
Even like I have seen the most of interview was like manager and deputy managers. They conduct the interview, right?
yeah,
So like what questions
exactly.
they ask literally, right? And I think now system is also a point-based system in interviews, isn't it?
Point-wise as well, and we do like
They,
most of the trusts will send the interview questions in advance. In some, not
yeah,
everywhere, in some of the trusts, they do provide the interview questions as well, and it's point-based as because it's tight competition, Jagvir. That's the thing. So
yeah,
the time you had the interview, that was the right time. Okay, so since then, the everything got like very tight. The competition was heavier. Because there are lots of people, even back from India, they're coming from Middle East, they're just coming to
yeah,
UK and getting their OSCE done, got the PIN
yeah.
number, but still, as you said, they want to try their luck. Uh,
Yeah,
that's the
that's
main thing.
true.
And also, there are people who come to the preparation, they do take the session and everything, but they just think like, okay, I got the recorded videos, I got the materials, I'll be having a mock session with sir, so that's enough. So
Yeah,
that's the main thing I want to share from you to the candidates who are watching this video. That is not only the resources or what I'm going to share, it's your hard
yeah,
work as well. If you don't
yeah,
do the preparation, if you don't do the homework, you will
yeah,
be able to speak up during the session.
yeah.
And I
Even like I think speak up is a big thing, isn't it?
yeah, because you've been very afraid when you're trying to speak during the our mock interview session. Then I just told you like, Jagvir, you don't need to worry because the interview panel will help you if you answer pretty decently. Yeah. And you simply need to go through what are you going to do every day as a nurse and just understand the questions. But you did your homework. Only because of that, you have managed to put all those keywords, elaborated those keywords. I think I have explained you through the answers, isn't it?
Yeah. Even the keywords you told me, especially the duty of conduct.
Yeah.
Like,
Yeah. Yeah. Have you
even when I got a call back, they were telling me, okay, Jagvir, you answered that. Like, they specially mentioned I'm mentioning a duty of control in my answer itself
yeah.
was the I think was the best thing. Like, because every time, even sometime when matron comes on round, they ask particularly, when they ask like, the
Yeah.
questions and answers.
Yeah.
Nowadays, even still when we are working there, they
Mm.
especially ask like, oh, do you know about duty of conduct? Because it's a big thing here, isn't
It's a
it?
big thing. It's a big. That's why, as you said before, it's just not the materials what we share, it's just the experience. So it's completely different. This is what you do in India. So you got that compassion and everything. But here you need to clearly explain in your interview what are you exactly going to do for the patient safety. It's a patient-centered care, collaborative teamwork, and the keywords like confidentiality, duty of candor, which you're mentioning. So it need to come from your mind, isn't it? Okay, this is the thing
Yeah.
we do. I'm responsible for. But again, hats off to your homework because you did your hard work, Jagvir. Okay, because I'm very proud because as I said, like from most of the students, I can tell you, you were one of the candidate who prepared really well, which I have given to you, and you were the one which you have listened to me. Okay, this is the one how you follow. So
Yeah.
you got the result from your first interview itself. So
Yeah, like that was like thing. Then you don't regret even
yeah,
doing
you did
anything.
the right thing.
Like I feel like it was the best time. Even like I didn't know about your profile or something.
Mm.
Sometime I think it's all God who
Yeah.
showed me your profile and
No,
give that idea
it's
in
all the
my
thing.
mind to approach you. Like even the best thing I think at that time, like when I saw you live in Nottingham, I was like, okay, it's a
It's
good
very
thing.
close as well. Yeah. I think when we discussed, you were like very near, isn't it?
Yeah,
Sandy.
at that time I was in Long Eaton.
Darlington. It's just the thing. It's just a fate to come through all the bits. Like you know people, and you come to the so finding the right people or right person is the best thing to do. But you did your work. That's how people do. If I were in your position, I will research for options. Okay. Because when I was preparing for any kind of interviews like 2019 or 2020, there were no options like this interview preparation or anything at all. So now
Yeah.
you've got the options. So then why not? You can put yourself into it. And this is a lifetime investment, isn't it? Because you're getting the job.
Yeah, that's true. That's true. It's nothing compared to what we get.
Exactly. So now look at you. You got the job. You're moved from Nottingham to Cambridge, like
Yeah,
hospital now. You're in the dialysis department, and
yeah,
you own your dream job now. So that's the main thing. And how about your family? Have they all happy, excited, and everything?
yeah. They were so happy. Like, they don't know the process, uh,
How to get through?
how I did it. But of course, they are so happy, that I did it. Like they are proud.
Yeah, that's just exactly.
Like, they are proud because they spend the money on, my studies. So of course they are proud that I'm doing the same
Now
work
you come.
in here, right?
Yeah,
Right. Otherwise it's hard to get job here in UK.
yeah, because you might know there are a
Most
lot.
of people work in a care home, like, they will do carer job and all that even after their nursing studies.
Yeah,
So they are proud that I'm working in the same job. And thank you to you as
yeah.
well to helping
No
helping
problem.
me out.
Thank you so much for you as well because you made us proud because we can now tell to people, look at the example. We have our Jagvir who did the like training. She did gone through everything and you made it done. So you got the job and everything as well. So which is the best thing to do. So like I know it's a hard work to get all up to this job level. But how do you feel the whole process? Like, have you felt supported during the interview preparation, the materials which we have shared to you? What do you want to give advice to the newly qualified, like who recently got the PIN number? Because you had a transition from the carer job to the nursing job now.
Yeah.
What do you feel with that? What advice you want to give to the recently pinned nurses?
Of course, I would say, material was really helpful. Even I told one of my friend, she was like, she got a pin in April, but I told her to approach, for interview preparation, but she wanted to try herself.
Yeah,
She went, she couldn't pass, and still she was struggling. And I told, now she's struggling to get a second interview. I told her, like, when she get now another interview, don't wait, just approach.
yeah, just
Like,
to get prepared.
she's applying. I think she got two interviews, but she didn't pass because some people just
Mm.
they want to,
And
go themselves and do
exactly.
whatever they want to do.
Yeah.
So, yeah, of course, interview preparation is
Mm.
I think much needed nowadays because of the competition we have. We are not supposed to know everything,
Yeah.
how it works. Like, we might answer the questions in a simple way
Yeah.
without mentioning the words they want to hear,
Exactly.
like, the keywords.
Yeah.
So, yeah, I would advise everyone to just approach and
Mm.
try to prepare before going for interview, because I think nowadays even the nurses who working in a care
Yeah.
home jobs
Yeah.
or working as a carer, because I know it's so hard job because it's a private sector as well, they uh, treat you differently
Yeah.
than how NHS treats you. Like, they would challenge you.
How do you feel now from the transition as a working
Yeah,
as a
I
carer?
can feel like, of course, there is a physical work, but mentally you are relieved that you are working. You have a job security. Like, it's kind of same like if you're working in our country,
Exactly.
like,
And you got
government
people
job, you
surrounding
know
you.
that, okay, you are in a government sector, you don't care about anyone, right? It's
Yeah.
kind of same thing. You have to, of course, you have to follow the basic things, basic rules here, like, about patients, confidentiality. It's
So has
different,
the
but
has the
still,
preparation
it's
yeah has the preparation helped you like when you gone into the hospital for the first time or coming into the team? Have you felt like the interview preparation helped you to understand what exactly is the basic picture of the hospital as well?
Yeah, that's true. Like, then you understand from the interview, okay, this is going to happen. These are the basic things there. Like, even about the system, how we
Yeah.
do the from the notes and how we
Mm.
work in that team itself.
Yeah.
Even you told me earlier, right? They're gonna give me a time when I was about nervous that how I'm gonna work, right?
Yeah.
So it's
Everything is fine.
exactly the supernumeracy and everything. Like,
Yeah. You got the
then you have idea, okay, this is going to happen when you approach,
exactly. Yeah. So
Mm,
now you know the process. Now you how to start it. Now you know there is a team to help you. Team
yeah,
like now you can progress as well. So don't stuck
yeah,
with the band five job. Think ahead. So just get yourself stable and don't stay still in the band five job. Look after for the band six jobs, band seven jobs. But step by step, you could learn the process as well. Okay. So like, what was your expectation before the interview preparation or coming to us? what was your expectation regarding the interview
Yeah,
questions?
I was expecting questions more later to like, the fields itself. Oh, they would ask me, like in India, do you know what's intensive care unit? But it was totally different. They didn't ask me anything related to if I know anything about dialysis. No,
Yeah,
they asked me the question you told me, right? They
exactly.
ask.
Most of the things. So the values
Yeah.
and
So
behaviors.
I was studying. Okay, they would ask me, okay, what is the types of dialysis? So
But it's because
yeah,
they know the thing
it
is
was not
they know
like that.
you'll be going for the training. And they
Yeah.
are pretty much sure they can train you as a dialysis nurse. Okay.
Yeah,
But before
like now I have a skills mentioned in my profile that I have a DASI skills, literally,
that,
isn't it? Because they taught me in a beginning.
everything. So you will go through all the competencies and everything. But before they hire you, they want to know that you got the basic values and behaviors, that you
Yeah,
follow the trust guidelines, you follow the NMC code and conduct, and you will make the patient safety, ensure
yeah,
everything, maintain the privacy, dignity, confidentiality. If they feel that confidence from you, then of course they will hire you if there are NHS interview, like NHS experienced candidates as well. That's what we have said because you haven't had any kind of NHS experience, and
no, no, no.
you won't be able to imagine because there will be lots of candidates maybe interviewed with you who had NHS experience as well. Okay,
Yeah,
but then you got the job in Cambridge Hospital. The main reason is because how you performed in your interview. Okay, so it doesn't matter whether your opponents are working in NHS or not. It only matters how you perform in your interview. That's it, and you
yeah.
are the proof or you are the example for that. Okay.
Yeah, that's true because before that I was thinking they prefer normally most like most of trust they prefer even if the candidate is
Yeah,
already working in
working in the
NHS
trust. Yeah,
because they know the basics because
yeah,
even if there is a system is different what the basics are same.
yeah.
But yeah, then I knew that of course like okay, um, people
But
can get a job like
yeah,
even from outside if they have determination to get
exactly.
something.
That's the main thing. So they feel that positiveness from you, then they will feel that okay, we can train Jagvir, and she will be one of the best quality nurse within our team. So if they get that feel, they feel like okay, you are a team player, then of course you will get the job, and they will praise you for your answers and everything because you might be the only one who told regarding the duty of candor. Okay,
Yeah,
even the NHS staff who had the interview, they might haven't even mentioned regarding this point at all
yeah,
because I do see lots of people coming to us as well who are currently working in the NHS and they feel like okay they know everything. Then I tell them no, this is not the way you need to answer. So then say oh okay because you need to show this is the theory side that you understand that you will show to your patient, to staff,
yeah,
and within the trust as well. Okay,
yeah.
but again anyway, well done, and thank you so much for spending your time and giving us
Thank you so much.
and
Thank you.
wishing you all the best in future as well. Okay. And
Thank
we
you.
are very glad that we've been a part of your successful journey. Okay. All right.
Thank you so much. Thank you.
No problem, Jagvi. You take care. Yeah.
Yeah.
Thank you.
You too. Bye. Bye. Take care.